Hello and welcome. I'm Dr. Elena with over 20 years of experience in men's health. And today, I want to speak directly to men, especially those over 40, about something you might not even realize is within your full control, your vascular health. More specifically, we're going to talk about how you can significantly improve circulation throughout your entire body, including the areas critical for male function and performance, in as little as 5 minutes a day. That might sound exaggerated, but stay with me. The science behind it is not only credible, it's compelling. The vascular system isn't a passive network of pipes, it's a complex, adaptive organ system that responds dynamically to the choices you make every day. And the good news? It can change rapidly for the better. To grasp why this is important, you first need to understand a vital fact. Your blood vessels are living tissues. They're lined with smooth muscle that can either contract, restricting blood flow, or relax, making it easier for blood to flow. These changes happen constantly in response to signals from your hormones, your nervous system, and even the way you breathe or move. Now, here's what happens to most men as they age. By the time you're in your 40s or 50s, your blood vessels, particularly the smaller ones in areas like the pelvis and genitals, are often chronically constricted. Not enough to ring alarm bells with your doctor, but enough to reduce function and responsiveness. Fortunately, with the right techniques, this constriction can be reversed quickly and naturally. At the core of this process is a molecule called nitric oxide, NO, produced by the endothelium, the inner lining of your blood vessels. Nitric oxide is your body's master key to vasodilation, signaling those smooth muscle cells to relax and open up. More nitric oxide means more blood flow, more oxygen, and better function. But here lies the problem. As men age, endothelial function declines. Less nitric oxide is produced, and the vessels become less sensitive to it. This is a major contributor to the slower, less responsive circulation many men feel. Luckily, science now shows that endothelial function is not fixed. It's highly responsive to specific interventions, even within minutes. Let's walk through a powerful 5-minute vascular activation routine designed to deliver almost instant benefits. This protocol is based on 3 key mechanisms. Number 1, triggering nitric oxide production. 2, activating your parasympathetic nervous system, which encourages blood vessel relaxation. And lastly, using specific mechanical actions to physically push fresh blood into areas that need it most. When combined, these mechanisms create a powerful synergistic effect on blood flow. Let's begin. Our first step is a targeted breathing protocol. This isn't just typical deep breathing. It's a specifically sequenced technique designed to maximize nitric oxide production and stimulate the vagus nerve, the primary nerve of your parasympathetic rest and relax system. Start by inhaling slowly through your nose for 4 seconds, expanding your diaphragm deeply. This means your belly should rise before your chest. This type of deep, slow breathing has been shown in clinical studies to reduce stress hormones while also enhancing nitric oxide release in the nasal passages. Then, hold that breath for 7 seconds. But while holding, here's a crucial twist. Hum. That's right, hum during the hold. Why? Because nasal and sinus tissues produce nitric oxide, and humming vibrates those passages, enhancing NO release. In fact, studies show that humming can increase local nitric oxide levels by as much as 15-fold compared to silent breath holding. Finally, exhale completely through your mouth for 8 seconds, making a gentle whooshing sound as you do. This slow exhale further stimulates the parasympathetic nervous system, inducing relaxation not just mentally, but in your vascular smooth muscle, boosting overall circulation. Complete this breathing, humming exhale cycle 5 times. It takes about 90 seconds and produces a rapid boost in NO levels and vascular responsiveness. Now let's move on to the second part, targeted isometric contractions. Simple, static exercises that increase circulation through a mechanism called reactive hyperemia. When you contract a muscle without moving the joint, then suddenly release it, your body floods that area with fresh blood, oxygen, and nutrients. We're going to use this to create a systemic vascular surge, especially in the pelvic region. Start with your glutes. Squeeze them together firmly for 15 seconds, imagining you're holding a coin between them. Breathe normally. Never hold your breath during contractions. When you release suddenly, you should feel a wave of warmth. This is blood rushing back in. Next, squeeze your inner thighs by pressing your knees together tightly, again holding for 15 seconds. Release fully. Finally, engage your lower abdominals, pulling your belly button in toward your spine. This intentional contraction also activates your pelvic floor and relaxes blood vessels in the lower trunk. Altogether, this sequence takes another 90 seconds, and it powerfully stimulates blood flow throughout the pelvic basin. Now, step 3. Dynamic pelvic movement, which further enhances circulation through mechanical stimulation of the abdominal and pelvic blood vessels. These movements act like an internal massage for your vascular system. Start with pelvic tilts. Stand with your knees soft, feet shoulder width apart. Tilt your pelvis forward by arching your lower back. Hold 2 seconds, then tilt backward by tucking the pelvis under and flattening your spine. Repeat 10 times slowly and smoothly. Then move into hip circles with hands on hips. Make 5 wide, slow circles to the right, then 5 to the left. This boosts blood flow and releases tension in the hips and lower back, which are notorious for impeding circulation when tight. Lastly, perform 5 controlled squats. Lower down as if you're sitting in a chair, hold at the lowest point for 3 seconds, and rise. These full-range movements compress and decompress your pelvic vessels, pumping blood in and out with each rep. After about 4.5 minutes, we wrap up with a final 30-second practice called vascular visualization. And while it may sound abstract, there is measurable science behind it. Thermal imaging studies show that focused attention and mental imagery can redirect blood flow. So gently close your eyes and visualize warm, oxygen-rich blood flowing unrestricted through your entire body. Picture all vascular pathways open and relaxed, especially in the lower abdomen and pelvic areas. Applying this protocol regularly gives you both immediate and long-term benefits. Within 15 to 30 minutes of completing it, your vascular system reaches peak vasodilation, increasing overall responsiveness. Doing it daily, ideally in the morning, progressively improves your base-level vascular tone. This means better function, even when you're not actively doing the protocol. Many men report that within 2 to 3 weeks, they notice tangible improvements, stronger morning responses, faster performance readiness, and even more consistent energy throughout the day. With daily use over 4 to 6 weeks, some regain levels of responsiveness they haven't experienced in years. To amplify the benefits, here are some scientifically backed enhancements you can include. After the protocol, try 2 minutes of temperature contrast therapy. Alternate warm and cool water on the lower body. Warm water dilates vessels, cold water constricts them. Repeating this process trains your vessels to become more responsive and adaptive. You can also apply acupressure to strategic points known to stimulate pelvic circulation, like the spleen 6 point on the inner ankles or the Ren 4 point below the navel. Just 30 to 60 seconds per point can boost the protocol's impact even further. Other optimization tips. Hydration is crucial. Blood is over 50% plasma, and that plasma is mostly water. Dehydration thickens your blood, reducing its ability to flow, especially in smaller vessels. Drink a large glass of water about 30 minutes before your protocol for maximum results. This also enhances nitric oxide production since your enzyme systems work optimally when hydrated. Timing matters too. Avoid doing this protocol immediately after a large meal. Digestion diverts blood to your gut and away from vital areas. Aim for 1 to 2 hours post-meal for best vascular reactivity. And don't overlook the power of stress management. Chronic stress stimulates your sympathetic nervous system, causing ongoing vasoconstriction. The breathing method you've just learned can dramatically disarm this stress response, both during the protocol and as a standalone technique you can use throughout your day. Lastly, track your progress. In the first week, you might notice warmer hands and feet, a great sign of improved peripheral circulation. Weeks 2 and 3 often bring enhanced performance, energy, and quicker recovery. And as the weeks go on, these improvements compound, with many men expressing that they feel years younger, functionally and energetically. So to close, remember this: vascular health is not fixed, it is trainable. And just 5 minutes a day, using techniques grounded in clinical science, can transform your circulation, your performance, and your long-term vitality. Thank you for listening. This is your Dr. Elena. Stay well, stay consistent, and remember, your health is in your hands.